documentation. The physician may use a S.O.A.P format to document the client's condition in the progress note. S.O.A.P is an acronym for subjective, objective, assessment, and plan. The patient's complaints or statements are subjective. For example, when the patient states how they are feeling and the symptoms they may be having, this is subjective as it is stated in their own words. An example of a patient's subjective statement may be, I feel weak and tired with morning activities. Objective observations are the reports that have pertinence in the patient's care, such as laboratory, diagnostic, radiological tests, with the results of the physical examination as performed by the physician through sight, hearing, and palpation. An objective complaint verbalized by a patient would be a problem that can be seen, felt, heard, or measured, such as a raised red rash or an abrasion, lump, or bruise. An assessment is the comparing and analyzing of the subjective and the objective notes in the medical record. The treatment plan is the final part of the S.O.A.P note. These are the specific measures designed to deal with a problem or complaint. The physician's discussion with the patient regarding care may include follow-up visits, possible medical testing, or referrals to a consulting physician, medications, and the prognosis for the condition. Cheddar format documentation. More cheese. Another format for documenting in the medical record is through the use of Cheddar format. When a patient sees a physician, the patient will describe the chief complaint, S.O.A.P, or symptoms in his/her own words as to why he/she is seeking medical attention. A history, H, of the present illness will be obtained, reflecting the physical symptoms the patient is experiencing and the contributing factors that have brought about the symptoms. The physician will perform a physical examination, E, and document in detail, D, the problem and complaints the patient is experiencing. Also noted are any medications or drugs, D, with the dosage that the patient is taking at the time of the exam. The physician then assesses all information obtained to form a diagnosis that can determine treatment. Visits are scheduled for follow-up care or referrals are made to an appropriate specialist. Cheddar. Chief complaint, history, physical examination, detail. Both formats of documentation using the S.O.A.P or Cheddar are Medicare approved. It is the physician's preference as to which type of documentation he uses in the medical record. A diagnosis, which is the final assessment the physician makes, is based on the medical history and the chief complaint of the patient, the physical examination done, and any laboratory or diagnostic test reports that rule out or suggest a specific disease. The treatment or plan of care for that diagnosis is then given to the patient to assist in improving his or her condition. This can include medication, hospitalization, therapies, or consultation with a specialist. The prognosis is the outcome expected for the given disease and the time of expected recovery. This information will be documented at the end of the history, physical or progress note, and it is imperative that the actual documentation is correct. Acceptable medical record abbreviations. As discussed previously, the S.O.A.P and the Cheddar form of documentation WAC is acceptable in a patient medical record. Some medical abbreviations are also acceptable and can be found in a medical terminology textbook or medical dictionaries. Some common abbreviations are found in Table 2:1. Thank you for coming along this journey with me. Have a good day.